Welcome to the training session on the COVID-19 vaccination data reporting for the healthcare personnel safety component. My name is Elizabeth Kalisle, and I work with the Division of Healthcare Quality Promotion at CDC. So before we begin, as a general reminder, please contact CMS with questions about reporting requirements using the email addresses provided on the slide. The objective for today's webinar is to review the simplifications and additions to the COVID-19 vaccination data collection forms. Toward the end of the presentation, we'll review frequently asked questions and share helpful resources that can be found on the Healthcare Personnel Safety Component website. Please note that the slides from today's session will be posted to the NHSN COVID-19 vaccination website in the coming weeks. The form changes that we discussed today will be available to users as of May 30th. So this means that facilities will start reporting data with the new form for the first week of June of 2022. So let's start with an overview of how the weekly COVID-19 vaccination data collection forms have been simplified. We will begin with reviewing the current version of question 2 on the data collection form. To simplify reporting, questions on reporting data by vaccine manufacturer for primary vaccine series will be removed. The image shown here is the new version of the primary vaccine series question. As you can see, the new version has been simplified to only 2 questions. Rather than reporting by specific manufacturer, facilities will report data for question 2.1, covering individuals receiving only 1 dose of a 2-dose primary COVID-19 vaccine series. For question 2.2, facilities report on individuals with any complete primary COVID-19 vaccine series. The screenshot on this slide shows the current version of question number 4 on the weekly COVID-19 vaccination data collection form for healthcare personnel. To simplify reporting the 4 questions about vaccine manufacturer for additional doses and booster doses will be removed. Rather than reporting by manufacturer, you'll report only the total number of individuals who have received any additional or booster doses since August of 2021. After obtaining feedback from facilities and stakeholders, and as the COVID-19 pandemic response needs change, the vaccine supply questions will be removed. So this is what the new data collection form will look like for healthcare personnel. On this slide, you will see the changes and updates. As we already reviewed, we removed the requirement to report vaccine manufacturers from questions 2 and 4. And question 5 is a new question added for healthcare personnel on the number of individuals who are up to date with COVID-19 vaccine. We will provide more information on this new question later in today's presentation. First, let's review how to answer questions on additional or booster doses. So let's review a few key terms. An additional dose is another dose of vaccine administered to people who are less than likely to mount a protective immune response after initial vaccination. People who are moderately or severely immune compromised should receive an additional dose. Question 4 asks about the total number of individuals who received any additional or booster doses. A booster dose is another dose of vaccine administered after receiving a primary vaccine series to enhance or restore protection, which might have subsided over time. In this example, we will discuss step by step how to report individuals who received only one booster dose. The first step, as shown here, is to make sure that question 2.2, any completed primary COVID-19 vaccine series, is entered. In this case, we've reported 30 individuals for question 2.2. Next, in question 4, report the cumulative number of individuals with complete primary series in question number 2 who have received any booster doses or additional doses of COVID-19 vaccine since August of 2021. So in this example, we reported 25 individuals have received any additional or booster doses. Let's now talk about the new up-to-date vaccination question that has been added. I will now turn the presentation over to my colleague, Jolie Siegel.
Thank you, Elizabeth. Before we discuss this new question, I would like to bring to your attention a note about surveillance definitions. NHSN's surveillance definition of up-to-date for COVID-19 vaccination data is based on CDC's clinical considerations and up-to-date definition for the first day of the reporting quarter. For the purpose of surveillance tracking, an NHSN surveillance definition must remain stable for a reporting quarter and will not be updated until the following quarter if CDC's clinical considerations and up-to-date definition change. NHSN's surveillance definitions are designed to assess trends in the population and inform public health response. NHSN must be able to standardize criteria and apply these definitions in a consistent manner across populations and time. Next slide, please. Now that we have discussed surveillance definitions, we will talk about the newly added up-to-date question. The image on this slide shows the new question. Facilities will report the cumulative number of individuals who are up to date with COVID-19 vaccines. We will review the current definition of up to date on the next slide. Please note that this definition may change over time. Therefore, facilities should refer to the definition on the first day of the recording quarter. The CDC NHSN team will be posting a document to the NHSN website with the current definition of up to date, and users should review this document at least once per quarter to check for definition updates. Next slide, please. For the period of October 3rd, 2021 through June 26, 2022, most individuals are considered up to date in two cases. The first case is when an individual received all recommended doses in their primary vaccine series and received at least one booster dose. An individual does not need to receive a second booster dose to be considered up to date at this time. And the second case is when an individual received all recommended doses in the primary vaccine series, but is not yet eligible for a booster dose. Individuals who are not yet eligible to receive a booster dose include those who received their second dose of a two-dose primary series of an mRNA COVID-19 vaccine, Pfizer or Moderna, less than 5 months ago, and those who received a single dose of Janssen less than 2 months ago. You will also note that there are 3 cases listed on this slide when individuals with a moderately to severely immunocompromising condition are considered up to date. Next slide, please. We will now walk through an example of reporting up-to-date vaccination status. In this example, there are 40 individuals, and 30 of these individuals have completed their primary vaccination series. Among these 30 individuals with complete primary series, 26 are reported to be up to date with COVID-19 vaccines. The 26 individuals who are up to date either received 1 or more booster dose, or they received recent primary series vaccination. As a reminder, refer to the table on the previous slide for the appropriate timeframes. Next slide, please. Now that we have reviewed the definition of up-to-date vaccination status, let's discuss an example. In one scenario, Bill received 2 doses of the Moderna COVID-19 vaccine for his primary vaccine series. He later received 2 booster doses of the Moderna COVID-19 vaccine. His last booster dose was 7 months ago. The question is Bill considered up to date? The answer is yes. Bill is up to date with COVID-19 vaccines because he received a booster dose. Next slide, please. Here is another example. Anne received 2 doses of the Moderna COVID-19 vaccine. She received her last dose 7 months ago. Is Anne considered up to date? In this case, Anne is not considered up to date since she has not received a booster dose even though she is eligible for it. Next slide, please. Now we will review an additional update. Next slide. One final change we are implementing is that completing monthly reporting plans for COVID-19 vaccination modules in the healthcare personnel component will no longer be required in order to simplify reporting for users. Instead, upon saving or uploading data, users will agree to the following boxed in green on this slide. The data reported are consistent with definitions outlined in NHSN surveillance protocols, including tables of instructions and frequently asked questions. And 2, the data will be sent to the Centers for Medicare and Medicaid Services, CMS, to fulfill CMS quality reporting requirements when applicable. Next slide, please. Let's now review some frequently asked questions, or FAQs, and example scenarios. These will also be included in the FAQs posted on the NHSN website. These questions are all answered assuming you are reporting data for the surveillance period of October 3rd, 2021 through June 26, 2022. The first question is, how do I categorize a resident who received a complete primary COVID-19 vaccine series of Moderna with the most recent dose received 4 months ago? The individual is considered up to date because they received their second Moderna primary series dose 4 months ago, so they are now eligible for a booster dose. As a reminder, eligibility for a booster dose is based on how long ago you received your final dose of your primary series, or, if immunocompromised, how long ago you received your additional dose. The individual would also be included in question 2.2 and question 5 of the data collection form. For question 2, an individual received a complete primary COVID-19 vaccine series 5 months ago, but did not receive any booster doses. The individual is not considered up to date because they have not received a booster dose despite being eligible for it. This individual would be included in question 2.2. However, they would not be counted in question 4 as having received any booster or additional doses. Next slide, please. Question 3 asks about how to categorize someone who received a complete primary COVID-19 vaccine series of Moderna and one additional dose 1 month ago due to having a moderately to severely immunocompromising condition, but no booster doses. The individual is considered up to date because they received their additional dose 1 month ago, so they are not yet eligible for a booster dose. They would be counted in question 2.2, question 4, and question 5. Question 4 asks about an individual who only received 1 dose of a 2-dose primary series and who wants to get a booster dose. How would this person be categorized? Well, individuals are only counted for the doses they have received. This person would only be included in question 2.1, received 1 dose of a 2-dose primary series. They would not be included in the questions on additional or booster doses, and they would not be considered up to date. Next slide, please. Let's summarize the main changes to the COVID-19 vaccination reporting forms that we reviewed today. The simplifications include that 1. COVID-19 vaccination data will no longer be reported by vaccine manufacturers for questions on primary vaccine series and additional or booster doses. 2. Questions on vaccine supply will be removed. And 3. Completing a monthly reporting plan to submit COVID-19 vaccination module data will no longer be required for months beginning June 2022. Additions to the forms include adding a question for facilities to report the cumulative number of individuals who are up to date with COVID-19 vaccination. Next slide, please. We will lastly review how to access the additional resources that are available to facilities. Next slide, please. The Healthcare Personnel Component website contains links to a variety of training materials, including quick reference guides, training slides, and information on CSV upload. The link on this slide will take you directly to these resources. Next slide, please. If you have any questions or need help, please contact the NHSN Help Desk. You can contact the NHSN Help Desk at nhsn@cdc.gov. This concludes the presentation.